Cancer is a life-altering diagnosis because of the diagnosis and the consequences, but also because it really takes over your life for many months and for some patients for the rest of their lives.
What we have realized is that as cancer care becomes more complex, it becomes more fragmented, and patients end up spending far more of their time burdened by our medical tests and our treatments. And while that's good in terms of advancing the science, what we've realized is that that has a great detriment on patients' quality of life and the time that they have to spend uninterrupted or undisturbed, where they feel less like a patient and more like a human. Cancer Care Beyond Walls is a platform that allows us to safely and effectively administer chemotherapy in patients' home. It allows us to be able to reach those patients where they live, where they are comfortable. That really makes a huge difference in patients' lives.
When they put me in this program that you can do this at home, would that be your choice? And I jumped on it and said, let me be the first to do it.
I couldn't be any happier. My quality of life is up here. I'm able to be with my sister. It's just such a convenience that I could go walk, check my time. Okay, my nurse is going to be here at 9. Pop in, get my chemo, my infusion, and then I go back out and continue my walk. It's been a convenience, is what it is.
This program of getting your chemotherapy at home has changed my life. As a PE teacher, I don't have to miss school days anymore. With this program, I can teach without worry because the whole staff comes to your home. It frees up my time and allows me to do things that I never thought I would be able to do again. I feel so great. My quality of life has changed significantly to a point where I never thought I'd be.
Being on this path that we're on right now, where being stable and being able to be right here at home and being able to do all the things that we've been talking about doing and actually going to do them, being able to look forward to things after going through the times where we didn't think he was going to make it, to going to plan vacations and futures, and it's just exciting and wonderful, and it's awesome.
The goal that remains the most important for us is actually to be able to offer care to patients who do not have the ability to travel, who do have significant barriers, both financial barriers or time barriers, to be able to bring the care to those patients, to be able to decrease these disparities in cancer care and overall in healthcare, and to transform delivery of cancer care. Cancer care is very personal, I think, for me. My daughter, my seemingly healthy 6-year-old daughter, was diagnosed with an inoperable brain tumor. So as a mom, I've lived through it all, and I lived through what the patients go through. As an oncologist, I was convinced that we can do more. As a mom, I would have given everything, even if a few blood tests were done at home and we would not have to travel, even if 1 in 5 infusions were done in the home and we would not have to go through all of this. After my personal experience and after my daughter losing her battle with this disease, I'm even more determined that I will fight it with everything I can. I will fight it by changing the way we deliver care and making it more comfortable for our patients. And I won't stop until we cure cancer.